Hey friends, welcome back to my channel. My name is Anu. For those of you who don't know, for those of you who are new here, make sure you subscribe, okay? I want to see you guys come back for more videos, so please hit the subscribe button down below. So today, guys, I wanted to talk to you guys about my psychiatry rotation and how that went and what that experience was like and all that. So stay tuned. All right, so my psychiatry rotation was done in November last year. It was my second rotation of my third year. It was 6 weeks long. The 6 weeks for us was divided into 1 week each, and each week would be on a different unit. So I know most psychiatry rotations are outpatient, but mine was inpatient, so we had a lot more exposure to a lot of variety of the different disorders under the psychiatry umbrella. So for me, like a regular day, we would have to go in every day from 8 a.m. to 4 p.m. Sometimes it was longer. We had days where we were on call, so we'll stay a little bit till I think about 7 p.m. or even sometimes on the weekends would have call for 4 hours. But on a regular weekday, it was 8 a.m. to 4 p.m. So a typical day would start with morning reports. For us, morning reports was basically students giving presentations of different topics. I know my presentation was on Parkinson's disease, prions disease, and chronic traumatic encephalopathy. So I think it's very important to actually pay attention to the presentations, because either number one, you can't remember anything about that disease and you learn a lot just by paying attention, or number two, your colleague or a resident or an attendant would just mention something odd that would just appear on your shelf exam, and you'd be like, wow, thank goodness I listened to what that person said. So I think it's important to pay attention to it. Obviously, like if you're doing your own topic, you're going to master it anyway, so that's also helpful for the shelf exam. But yeah, we'll talk about the shelf later. Let me talk about my rotation experience for now. So yeah, we do presentations from 8 a.m. to 9 a.m. And then by 9 a.m. we would go to our different units. We had the geriatrics unit, we had the PEDS unit, we had the involuntary units, we had the addiction units, the detoxification units, and all different types of units. So we'd go to our different units and then we would round with our attendants and with our residents. And sometimes, depending on the unit, we'd get assigned, like they would assign the students like a couple of patients to go see by themselves, to go talk to, just so we got that experience. And for some units, like the invol units, we were not really allowed to talk to the patients because things could get aggressive or out of control. So that was pretty cool to see, especially when the patient got aggressive, to see the different like de-escalation protocols. And then for the round, sometimes we were going from patient room to patient room to see the patient. Sometimes we were sitting down in a room with the attendants, with the residents, and the patients who come in one by one. So it was pretty interesting to see the psychiatrist and the patient bond, and how because psychiatry, you're talking about emotional things, you're talking about like mental things. It's almost like you're exposing yourself to people. So to see the psychiatrist get that out of the patient, or the comfortability level, or that doctor-patient relationship that psychiatrists are able to develop with a patient, for them to open up and tell them like personal things about themselves, it gave me a newfound respect for psychiatrists. Like I respected psychiatrists before, obviously, but just to see that was just like a next level type of respect that I found for them. After rounding, after talking to patients, we would have lectures every day from 12 noon. Like a resident or an attendant would sit down with us and just talk about a topic, and then or we would discuss cases that we had seen that was interesting during the day or during the week. So that was wonderful as well. But yeah, in general, psych was such an amazing experience. I got to see a variety of different cases, from schizophrenia, about schizophrenia. So one of the things we learn in medical school, one of the buzzwords that we learn in medical school for schizophrenia, is this thing called flat affect, which I will put the definition down below. So like I know once I see flat affect in a question, like, oh, it's probably schizophrenia, one of the schizophrenic ranges of diseases. But like to actually see what flat affect presents like, what it looks like on a person, on a patient, it's definitely something I would not forget in a hurry. Like that's definitely something that's ingrained in my mind. So now I know, once I see schizophrenia, I know flat affect. I don't just like theoretically know it. I actually like know what it looks like. So we saw a variety of diseases: schizophrenia, mood disorders like depression, anxiety, bipolar disorder, personality disorders like borderline personality, substance use disorders, and how those are managed. I think that's pretty much like all I can say right now about my like psychiatry rotation itself. So let's talk about the shelf exam. So for the shelf exam for me, I studied using Uworld, which is a question bank for those who don't know. Uworld and the step 1 first aid book. So Uworld I think had about 500 psychiatry questions, so I went through those questions twice, and then I marked like questions that were more difficult for me, and so I went through the marked questions like a third time just to make sure I had it right. And the thing about Uworld is like there's some psychiatric conditions that like it's like literally one symptom that differentiates it from one or the other. So a lot of the Uworld questions like helped me differentiate like between this condition and that condition, so it was pretty good. And the Uworld explanations are also like key. Make sure you like take notes of those and all that. And for the things I could not remember, or for the pharmacology of the psychiatry drugs, the pharmacology aspect of psychiatry, I used first aid step 1 to help me get through that. So for me, Uworld and first aid step 1 were like the key things I used, and I did pretty well on the exam. Other resources that I've heard that's good are I've heard that Case Files is good. I've heard that Online Med Ed is also good. I use Online Med Ed for all my other rotations, so I definitely know that they're a good resource. And first aid itself has a psychiatry book, so I've heard that's also pretty helpful. And you can also use the DSM, because like the DSM has different psychiatric disorders in it, and it's going to list all the things, all the symptoms that you should be looking for in order to diagnose that disease. So that's definitely something you can use as well. I think that's pretty much it about my psychiatry rotation experience. It was really fun. Psychiatry was really fun. Thank you very much for watching. Make sure to like this video. I want you guys to share this video, because I know we're not going like into the clinics for rotations right now, but eventually we will again, so someone might need the information, so share it. Leave a comment down below. If you have any video ideas or any suggestions of videos you want me to do, let me know down below in the comments. And please don't forget to subscribe. Okay, subscribe. All right, I'll see you guys in my next video. Bye.